Hello, I'm going to go over the biomechanics of the elbow and different arm slots and throwing a baseball. So to start off, to know the anatomical structures, it's important to know the main joints, muscles, bones, and ligaments of the elbow. So some main joints to know is the humeral ulnar joint, main elbow joint, and allows for flexion and extension of the elbow. And the muscles that allow for flexion include the bicep brachii, brachialis, and the brachioradialis. And the extensors include the tricep brachii. So those ones are going to be vital for how the elbow moves in space. Some main bones that are connected to the elbow joint is the distal humerus, the ulna, and the radius. And it's important to know the ligaments. The UCL is going to be the main ligament, the ulnar collateral ligament, the LCL, and the annular ligament of the radius. For planes of motion, the elbow moves through flexion, extension, supination, and pronation. And the axis that it runs on is the sagittal transverse axis, and it runs through the medial lateral axis of rotation. So you can see in the diagram of some more anatomy and physiology functions of the elbow. So to define linear kinematics is to understand the studying of how objects move through spatial and temporal components in a straight line. So when using linear kinematics, one could define an athlete's change of position of their elbow through spatial analysis. And we can use spatial analysis to quantify the difference between the final and initial position of the elbow joint. And the change of position can be quantified as a vector, which will measure the displacement of the elbow joint. Once the displacement is found, the displacement can be implemented in the velocity formula, which is displacement over a change of time. And you can find the rate at which the position is changing. And you can see in the figure of the position time graph and displays how the position of the body changes over time. And this can be used to measure the pitcher's body speed through its pitching motion and kind of seeing how he moves through time. So the angular kinematics, when looking at it, it focuses on the description of angular motion without regards to its cause, but it mainly focuses on angles and the change of angles. So through this, we could use absolute and relative angles to describe the orientation of the elbow in space, and the absolute angles could determine the orientation of the segment angles with respect to knowing the position of the proximal and distal ends of the segment, and the relative angles could be used to determine the joint angles, and we can use this to determine the elbow's relative angle by knowing the segment angles of the other joints in space. So if you know the wrist and the shoulder joint, and you can see in this figure, we can use this to measure the athlete's arm angle, and you can see in comparison where the wrist is at, their shoulder joint is at, and their other body parts in relation to their elbow joint. Linear kinetics is important to know because it's defined as a study of cause of motion in which all points on the object of interest move through the same displacement the same time, and it's pretty much studying the linear forces. And we can use this to understand impulse, which impulse is understanding pretty much how force is applied during time to cause momentum of an object, and impulse and momentum can play a vital role in the different phases of the pitcher throwing a baseball, especially to help prevent injuries and improper mechanics of the athlete. When throwing a baseball, a pitcher can increase their impulse by strengthening their arm in order to create a stronger force behind the ball that they're throwing, or they can also develop a better throwing pattern to increase the duration of the force being applied to the baseball. A pitcher can increase their duration by having a longer follow-through phase, splitting their hands as soon as their leg is ascending from their wind-up phase, earlier cocking motion, releasing the ball at the optimal time. So this could be used and displayed in a force time graph. And in the force time graph, you can see the area under the curve represents impulse, which impulse is the amount of force being used within the time to change the momentum of the objects. And then with that in mind, we can move on to angular kinetics, which can be identified as the study of cause of angular motion and explains the causes of joint rotations and provides a quantitative way to determine the center of gravity of the human body. So it's important to know, to understand this, to implement torque into studying it. And torque can be used to describe length of the moment of force of the arm, and to be able to quantify the rotation effect of the arm lever. Torque is what creates biomechanic movement, and being able to maximize the amount of torque the muscle could generate will allow for optimal power and movement. And this can be important during pitchers' movement and identifying flaws in their biomechanics, because pitchers can quickly throw over 100 pitches, so it's important to know the amount of force and torque being used on their weak tissues or if their muscles are fatigued during a game. And these flaws can be used to identify UCL ruptures and can be used to help prevent that, since that's going to be a main cause for elbow injuries in pitchers. And you can see in the figure, it shows the forces acting on the arm, and it's important to find the right angle of the maximal muscle force during a movement. And lastly, movement screening. So prior to baseball throwing and their programming, it should be important to incorporate functional movement screening to test their range of motion, especially their shoulder, elbow, and thoracic mobility. And to correct their movements if there's any dysfunction or if they're having a UCL injury, the athlete should try corrective exercise for the shoulder joint, such as implement kettlebell stability holds, banded face pulls, or using foam roller for their latissimus dorsi. For the elbow joint, it's important to include soft tissue work, banded stretches for their bicep and tricep. And in addition, the athlete should work slower progression before they go into more vigorous exercises. The end result would be to provide better shoulder and elbow mobility for the athlete as they perform their throwing motion. By preventing joint stiffness, muscle fatigue, we can decrease the athlete's risk of injuries and UCL.